So very good morning to you all. The organizers of the conference, the editor, Mr. Vikas, his team, and respected co-panelists and guests and members of the pharma industry, the IT world. It's indeed a great pleasure to be here today in this conference. So, while interacting, as part of the health department, there's always a lot of learning from every sector that we touch upon in this large field of healthcare. The most crucial, I would say, is definitely that of pharma, because ultimately in the delivery of the health services, this is a key factor. And in today's agenda, I realized that the canvas is huge and there's a lot of innovative practices are also being talked about. In sharing my thoughts, I think it'll be part of what I do as the Secretary for Health Department, and apart from as a technologist and my own take on what are the more exciting things which are coming up in this field. First of all, let me share with you the kind of extent of what Maharashtra's healthcare department is. So we have more than 10,000 sub-centers, which is the cutting edge of healthcare at the fields. We have close to 1,900 primary healthcare centers, 200 plus hospitals, and we employ close to more than 2 lakh people, including more than 20,000 doctors. And we roughly, in dollar terms, the annual budget of Maharashtra's health department would be about $2.5 billion. So it's a huge field, and the responsibility is huge. The challenges are always emerging. In this aspect, it's as was mentioned earlier, it is my great privilege and honor to share with you a very new development, which is the Maharashtra Medical Goods Procurement Act. People in the industry may be knowing that most of the states have a government corporation or a company which, for example, in Tamil Nadu or Rajasthan and other states have been doing it for many years. So taking upon that idea, we felt that the time has come to give it a proper framework of law. And in fact, it's my great privilege to be part of this process. And this is the first state in the whole country to have an act for medical goods procurement. And I think it will be it's an example for many other states to follow. And why an act? Because this gives a framework which in course of time would be expanded into various establishing of various standards of the procurement process itself. Be it encouraging the Indian industry, being, encouraging the innovation in this industry, or looking at global collaborations. So this authority is going to be headed by the Chief Minister of Maharashtra, with the Honorable Ministers for Health, Medical Education and Food and Drug will be part of that authority, apart from all the senior officers from the departments. And it's going to be a new organization, something like it's an independent organization which will have its own technical manpower. Now we are building it on strong IT platforms, and in the next few months we'll be setting it up. And I'm happy to share the vision of the leadership and the Honorable Chief Minister and our Honorable Deputy Chief Minister have been closely involved in every step of this process. So this authority would not only look at procurement for the government departments, but in the long run we look at it as an institution which would even cater to other private organizations. So be it trusts. Once the things are established, it could be doing procurement even for other smaller states or other organizations. So it's with this great vision we are beginning this journey, and we are sure we will reach out to you. Now, having mentioned this, the other exciting thing, of course, is the National Digital Health Mission, which is the Honorable Prime Minister's great game changer vision for the coming years, in which the entire value chain of the medical ecosystem, not only the hospitals, but even individual clinics and individual healthcare professionals, diagnostic centers, pharmacies, all are going to be uniquely identified by this digital health mission, and which would be giving a huge platform for discovery, for creation of even specific apps. So that is the next phase which is you're going to see. And I wish the participants of this conference would be getting on to this game-changing idea as pioneers. Imagine having your own apps to make relevant healthcare facilities available to the citizens at very low cost and within a particular geographical region. So all this is going to come about through this very secure platform. We are keen in the next couple of months, we'll be reaching out to the industry to partner with us to develop this system. We're looking forward to that. Now, having said that, the industry now, as we see it, cannot live without data. That is again the digital health mission. We have been, Maharashtra is one of the highest in the country, having the ABHA, which is the Ayushman Bharat health account. It's a unique identifier, it's a Aadhaar of the health world. So we are massively rolling out to the patients. Now we look at digital health and electronic medical records and electronic health records as the building block of everything which is going to come. So combining that with the digital pharmacy angle and looking at patient data. Now, why I think is very relevant for this particular conference is, and as a technologist, I see how AI and machine learning is going to be really a game changer. And number one, I feel it is going to bring down the costs of development, the timeline of development. The R&D, I think the R part is going to be much more faster. The research is maybe more rapid. The days of buying maybe 100 papers to professional papers, or hiring the top experts, or looking for the best brains may be replaced by more efficient algorithms which will probably read 1 billion pages for you in a month and come up with a report of what's happening in your chemistry world or your developmental processes. So big data is going to, big data chemistry is one part which I think is going to really change. And now with the second part is, I think, the development process itself. And since I'm in touch with a lot of people in the big data community and the machine learning community, one of the most exciting thing is actually the virtualization of drug trials, the impacts of the drugs on let's say the interactions, the drug interactions, the negative effects, the side effects, with less cost and less time. And the regulatory frameworks are such Even in our own country, drug trials are not that easy. So the virtualization of this, and all of this depends on very robust patient data. Now in healthcare, now we are looking at even, we are piloting AI-based diagnostics, AI tools reading X-rays and CT scans. Unbelievable amount of information is uncovered by AI algorithms. An iris scan has been proven to be a greater predictor of inherent diseases than most of the blood tests. So these are the kind of things which will come down, will bring down the costs of the drug development and development cycle. Literally, you could have a virtual manufacturing process to test your drugs. And apart from this, I feel that the essential thing for our country is to bring down the cost of medicines. Now, only last week, on behalf of the Department of Pharma, which is our parent ministry being the Health Ministry and the Union Government, we did a Jan Aushadhi Divas promoting generic drugs. So why is the need for that? Why is the need for that? Because of the increasing creeping costs of drugs. It could be patenting costs, it could be delivery costs, or manufacturing costs. So there is a social obligation to bring down the cost, and I think the technology behind this is going to be a big game changer. Another exciting thing is, of course, the VR world or the gamification. I mean, there's an interesting anecdote which I'd like to share. Some of the molecules were literally, given the stereo imaging involved, a couple of molecules were impossible to crack. So there was a great experiment a few years ago where they built a game platform with virtual VR technology and left it out to a few thousand users as a visual puzzle to crack. And what hundreds of thousands of hours could not do, a mass processing of gamification of the technology brought down, and that the molecule was actually discovered. There are so many innovative concepts which could be bringing a change in this industry. Of course, there's a lot of, the pandemic has really opened out international collaborations. We have a lot of opportunity to interact with international companies and missions. And on behalf of Maharashtra, I also would say that we are in the process of coming up with a health tech park. And it is being planned. And so that would be a big change in the way we do things to bring technology and development right into the within the state of Maharashtra. When we look at development, there are pharma clusters in Maharashtra, some of the most leading ones. So we are looking at a greater development of the entire value chain. And we're very keen on working hand in hand with the industry based out of Maharashtra. In the coming years, digital health, and we are revamping the whole healthcare system to go fully digital. So yeah, I'm sure you will see the changes coming up, starting from electronic health records right down to analytics. We are sitting on probably zettabytes of data. Government collects a tremendous amount of data. Unfortunately, there's not much analysis. So we are keen on building medical analytics to look at that would be of great help, especially for the kind of what was mentioned, like newer developments like immunological or even personalized medicine, precision medicine, predictive health, gene testing, and specified genetic medicines. So the day may not be very far away when your own body is going to produce the medicine that you will consume, and probably the day is already here. And what is, I think, a new era which is coming up, will be definitely mentioned in this conference. And we are eager to look at the development. Now, with this authority in place, we have very consciously kept a wide scope for innovation. So, we are very keen to promote innovative technologies, and even though with proper procurement procedures and guidelines, the encouragement of innovation and new technologies will be a very key factor. I think that is definitely going to be seen in the coming days. To summarize, so the digital health mission and the very dramatic changes which I think AI and analytics is going to come about in public and private health, I think is something which we are all in together. So once again, without taking much longer time, I thank the organizers for having me, and congratulations to the team for putting up a fantastic agenda. Very topical things are being discussed, and I think there is a need for constant engagement between the private and public domains. With healthcare is not just a preview of one part of the society, be it the private or the public. We are all in it together. So looking forward to more frequent and valuable interactions, and I'm sure this conference would definitely be a seed for so many new things which will happen. So once again, wishing you the very best for the day, and thank you so much.